And now, it's BoomerLife, lifestyle discussion designed to make your life more engaging, meaningful, and complete. Celebrating the baby boomer generation, this is BoomerLife on CIL 650.
Last night, I didn't get to sleep. No, I didn't get to sleep at all.
Hey, and welcome to the show. This is BoomerLife, and we are talking about getting a good night's sleep. If you sleep better, you live better, and we have the SnoreDentist in studio with us. And some people are going, SnoreDentist? What is a SnoreDentist? Well, Dr. Charnel Muir is in North Vancouver. She practices in North Vancouver. Her website is SnoreDentist.ca. And Dr. Muir, you started out as a dentist, right? I
did.
And then you became the SnoreDentist.
I did.
So explain for somebody listening for the very first time, what does the SnoreDentist do?
So my practice provides therapy, oral appliance therapy for snoring and sleep apnea. So I help people breathe better and breathe quieter at night so that they get better sleep and their lives are improved.
Now, I'm sure there's people listening today that have never heard of this, and this is a revelation to them. And they may be quite happy because someone in their life is snoring. So is that one of the reasons why people contact you, just because of the noise?
Yeah. So snoring can be one of the main reasons that people contact me. They may have seen over the counter or in the drugstore or online little boil and bite appliances or things you can do yourself at home kind of thing. But they didn't know there was a custom-made medical device option that they could use for snoring. And they're very comfortable, they're easy to wear, and people are thrilled to have found one. And
you need to be not just a regular dentist. You have to go on. You have an extended education that provides this for your patients. So explain how you're different from your regular family dentist. Right. So I am a general dentist by education. My first degree was in Doctor of Medical Dentistry at UBC. And then I continued on with studies that were in this field of what's called dental sleep medicine. And I went down and I did what's called our board exams with the American Board of Dental Sleep Medicine, and I presented cases, and I've done extracurricular studies to be able to limit my practice in a way that this is all I provide. I don't have a dental practice or a general practice anymore. I focus strictly on oral appliance therapy. And when patients come to my practice, I'm not checking them for cavities per se. I'm not doing anything else. And if I do, I certainly let them know they should go see their dentist. Right.
They still have a general dentist, and it's important that they maintain health in their mouth, because those teeth and those gum tissues are the basis for my appliance stability. And in order to have a stable appliance, I really need a healthy mouth. Yeah.
Okay, so this is a very limited group of people in British Columbia. You're down to, I think last show you mentioned you're down to 2 people.
There's going to be only 2 of us fairly shortly, yeah. So one's retired, one's retiring this year, one's 82 last month. So there's a couple of us that are in the under 70-year-old club. That are diplomats.
You're well under 70.
Well under 70, that are diplomats in dental sleep medicine, which means that's all we do in our practice. So we're hard to find in that way. And so because of that, often an oral appliance won't even be suggested to a patient because, your physician, your family doctor can't recommend a therapy he doesn't even know you can find. Mm-hmm. So it's important that patients speak up for themselves as well and say to the doctor, I really want this therapy. Or if patients come directly to me, they don't need a referral to see me. You don't have to be referred by your physician.
That's not like a specialist for your dog. Yeah, that's one of the things in our medical system. You have to always go back after 6 months. But with you just go right to SnoreDentist.ca and book an appointment.
That's right. Because my services are not covered under MSP.
Sure.
So my services are usually, if we end up treating a patient, they will be covered under their extended healthcare benefit plan. So their workplace benefit or their private benefit plan.
Under what category typically? Is it
believe it or not, there's a sleep apnea category
Really?
for extended health benefits.
Okay.
So some plans will only offer limited therapy options, but the good plans will offer the therapy option that's of value to the patient, which could be the appliance.
Now, when you were practicing as a general dentist, having people in the chair doing the fillings and all that kind of stuff, and then you were doing this sleep therapy, when did you know that it was when you were going to transition over 100%? Like, there must have been a transition time there. Was it becoming so popular that the regular dentistry had to sort of step back?
Not as popular as it became more encompassing for me. I just wanted to do it more. It's what I wanted to focus my path on. It's really what I wanted to do in practice. But dental sleep medicine hadn't developed to the point early on where it was all I could do. You know, it was so limited in its availability, or there weren't that many appliances, or there wasn't the studies behind the appliances to show effectiveness. The appliances weren't written into the guidelines for therapy. So once all of that started to develop, I knew I could do this as my career. So early on, I did do general dentistry, and then I would do some orthodontics, general dentistry, and sleep. And then it became orthodontics, which is braces, and sleep. And then it eventually became just sleep. Yeah.
Okay. If you're somebody that's listening to this and you have somebody in your life that is snoring, and before, how did people deal with this? I mean, you're saying it's a fairly young practice, right? Doing these oral appliances. So in the past, what did people do? They just put up with it.
They just put up with it, like really before 1980, there was no treatment for sleep apnea. Not that long ago. So, in 1980, the first CPAP was developed. And before that, there was no therapy short of tracheotomy. I mean, that if you stopped breathing enough, then they offered to put your windpipe further down your airway so that it bypassed all the blockages. But,
that's extreme.
Yes, it was. And the CPAP was developed as a response to a younger patient who had severe sleep apnea and refused the surgery. But CPAP was first developed. It's that machine that has the mask and it blows air and it keeps the airway open. And that just wasn't tolerable for all patients, and it wasn't appropriate for all patients. So the oral appliance was developed in the late 80s, early 90s.
Now, I seem to hear more about sleep apnea recently in the last few years. I don't know what it is. Is there more coverage of sleep apnea? I mean, you're doing a radio show now, but it just seems to be more awareness around this issue. Was it just buried before? People didn't really talk about it?
We just didn't know.
Is that just ignorance?
Yeah, we didn't know.
Yeah.
The sleep world is relatively new as far as a science and study goes. We didn't know the role that sleep apnea was playing in a lot of the health that the patients were having. So high blood pressure, diabetes, weight gain, disruptions in sleep. We didn't know it was this hidden sleep apnea. We didn't know it was the middle of the wheel of all these spokes that, you're trying to control. You go to your doctor and you complain about the high blood pressure, or they complain because they found it, or you complain about being tired, or you complain about this, and so they deal with all these individual things. And lately we've found that sleep apnea can play a central role in all of those things. So now whenever we talk about high blood pressure, it often mentions sleep apnea. Well, it never used to. Or whenever we talk about developing diabetes, now it mentions sleep apnea. So it's become more known. It's also a very large population. Our boomers are a very large population.
Sure.
So they're the biggest experimental group we've had.
So whatever the boomers need, that gets focused. And that's been a complaint of the boomer generation, is that
they get the focus of it.
Of pretty much, all through their lives, right? So
and they're living longer.
Yeah.
So they're experiencing more things. Nobody ever talked about AFib before. And now I talk to patients about AFib on a daily basis, and it's related to sleep apnea in some patients.
So what's the average age of somebody that is developing sleep apnea? Is there an average, or is it too broad a spectrum?
It's a very broad spectrum. We see it even in pediatrics. Even children can have sleep apnea. So it can cover any age group, but I will tell you that once you're over the age of 50, there's certainly an increased rate of it.
Mm-hmm.
Yes.
And women, it changes with as they get older.
Menopause.
Right.
Yeah. So we find with women, studies have shown that they will have a doubling in rate of snoring post-menopause, and they can have a 6 to 9 fold increase in sleep apnea post-menopause. So yes, it certainly can strike women later in life, but it can also present differently. And many women are misdiagnosed for years. They're perhaps diagnosed with depression. Well, they don't have depression. They actually have sleep apnea and they're fatigued.
So people are listening to the radio right now and they're thinking, well, that's not me. I just snore. I'm a loud sleeper. So, what's the percentage of people coming to you because they really feel that they have a medical issue versus they're just noisy?
No, at least half my patients come to me because of the snoring. It's either causing issues at home and their bed partner has kicked them out, or their bed partner no longer sleeps in the same room, or they've been threatened. You go or else, right? They won't vacation. Like I have spouses that won't vacation together anymore without a separate hotel room.
That's expensive.
Yes. I know I had a lady in the other day who was kicked out of the cruise ship room and had to wander the hallways at night because she was snoring so loudly nobody else in the room could sleep.
Wow.
So she ended up at my practice because she really liked to go on cruises and wanted to go on another cruise, and cruise ship rooms are really small.
They're very small.
So about half my patients will come in as a result of snoring. Another one, divorced, dating again. Not sure that you're, that getting to that next stage thing, and you snore, and that's embarrassing. And like, well, either I treat the snoring and pretend I just wear a night guard at night or a retainer at night, or I stay awake all night because I'm afraid to fall asleep and snore.
Yeah, I bet. But I guess apnea dentist didn't have the same ring to it.
Didn't have the ring, yeah. You know what? Snoring is so common. It's so common, and it really registers with almost everyone.
Everybody.
They either snore, they sleep with a snorer, they have a relative that's a snorer, they grew up with grandfather snoring. Snoring is so common. Now, unfortunately, because of that, we also accept it as normal.
Sure.
And it's not, it's just common. But, people are more apt to treat something that it bothers other people, and that's often what'll drive them in.
And the best way to find out is to go to SnoreDentist.ca. That's Dr. Charnel Muir's website, and you can book right on the page there.
Yeah.
When we come back, we are going to talk about snoring and how you can stop it. Of course, we're going to talk about snoring. No, we're going to talk about New Year's resolutions.
Yes.
That's what I wanted to talk about, because here we are, the first days of 2017. It takes a while to say 2017, but we'll be back next on CL 650.
Celebrating the baby boomer lifestyle. This is Boomer Life on CL 650.